Social aspects. Social aspects play a big role in the treatment of various patients, especially when they are being treated through Ayurved. Modern medicine has been established as the pathy of first choice worldwide. Moreover, its views have been incorporated in the curriculum since childhood. As a result, whole generations have been born and brought up with the same attitude. When people have to turn to something like Ayurved in despair, at least to find out some solution if possible, the first thought that struck the mind is about the scientific nature of Ayurved in modern perspective. This is quite natural, but one should be able to keep aside modern views and try to understand Ayurvedic principles. This is very difficult. Unlearning something which is inscribed for generations is a very difficult job. This gives rise to many misconceptions and misunderstandings. As a result, the patient is really in a puzzled, anxious state of mind before commencement of Ayurvedic treatment. Not only that, the state may continue during course of treatment and even after completion of successful treatment, especially if the relatives and friends keep on disturbing and puzzling the patient in spite of a recovery from a very acute stage. There are various situations when the patients want to have to turn towards Ayurvedic treatment. In the last phase of cancer, when the disease is progressive, there is nothing to be offered by modern medicine. The patient has very little choice and is forced to turn towards an alternative like Ayurved. If one gets relieved and at least gets better quality of life, he spreads a good message about Ayurved and the Ayurvedic physician. If a patient comes in early stage, when there are chances that modern medicine can offer some treatment, should one avoid the modern treatment, or can one have both treatments simultaneously? If both are concurrent, whether there will be any untoward effect, what dietary regimen one has to follow. These are various issues and the answers are very difficult. These are the egos about knowledge and experiences, attitudes and experiences about other medical systems, economical statuses, etc., which play an important role in making a decision. The doctors, relatives, and friends keep on influencing the patient from time to time. Actually, one should have a proper judgment of the condition, the likely advantages and disadvantages of the treatments, and the expected outcome, and only then make a decision. Unbiased opinion is very important in these situations. I was treating a case of non-Hodgkin lymphoma with metastasis in liver and spleen. Both were enlarged and bony hard. The relatives had already consulted oncologists and knew that no treatment could be offered by modern medicine. The patient was kept on only milk diets and he showed good progress. The enlargements of liver and spleen started reducing by one finger per week. In spite of this achievement and no possibility of any treatment of modern medicine, the patient's son told me that he is discontinuing the treatment. The reason behind was the opinion of the relatives, stating he is killing his father by denying allopathic treatment for saving money. I was really shocked and got frustrated. I tried to explain that Ayurveda is for saving life and not for killing. Nothing worked and the patient left away. This case very well explains the social aspect and general opinion of a common people about Ayurveda. The situation will not change till a large population experiences advantages of Ayurvedic treatment and or Ayurveda gets its place in school education. Hence, it is of utmost importance to be cautious about choosing any treatment, especially in diseases like cancer, heart disease, diabetes, etc. One has to have a proper judgment of all possible outcomes over even a prolonged period, weigh the benefits and disadvantages properly, look for all possible options, and then only make a firm decision. One should not feel guilty about the decision afterwards. The doctors, the relatives, the well-wishers keep on giving their advices from time to time. But once a decision is made, one shouldn't deviate from it. It is not appropriate to blame the decision afterwards. Making no decision is even more dangerous because it may lead to a very uncertain situation with no chance to escape. In India, it's often seen that people are afraid of asking the modern doctors the possible outcomes of the treatment. They just surrender themselves to any treatment and later on feel sorry for that. In such a situation, if they turn towards any alternative like Ayurveda, they are very cautious and anxious while beginning the treatment. In short, one should really look into benefits and disadvantages or losses for a longer period and then only make a decision. Fear about a disease leading to stress and depression. There is an overall impact that cancer is a dreaded disease causing untimely, miserable death. This is really an outcome of unscientific, unidirectional approach of modern medicine. Modern medicine could establish the principle of destruction of abnormal cells either by surgery or chemotherapy or radiation. In especially localized cancers like cancer of the breast, it is very well seen that even after considerable time of 15 to 20 years, some cases have remained disease-free. This is possible if the cancer cells are totally destroyed and the regions do not repeat. But if either the disease is diagnosed in an advanced stage, this is rather more common, or the total irradiation is not possible or the causes continue, then this principle of destruction of cells doesn't work. Moreover, chemotherapy and radiation suppress the immunity and the disease recurs or spreads to different places. Inadequate surgery or even FNAC or a biopsy also helps to spread of the disease. As a result, the patient reaches a hopeless situation with a lot of stress leading to depression. This again worsens the situation. Ultimately, the patient dies untimely and miserably. This creates a very negative impact about the disease, causing fear. So, even with the suspicion of the cancer, the stress and depression start playing their role. They are more horrible than the disease itself. If it is very well known now that this principle of destruction of cancer cells doesn't work or even is more harmful to the patients, why should it be implemented in such cases? Why FNAC or biopsy is done when the surgeon knows that in such an advanced state, modern medicine cannot offer any effective treatment. As a scientific system, modern medicine should have discarded this principle in advanced states and should have searched for some other principle. But the approach has mostly remained unidirectional, leading to miserable untimely deaths and creating fear about this disease, leading to stress and depression. The situation will change if people have other options in the form of alternative medicine and if they are able to make up their minds to accept them. With success in this direction, the overall impact about the disease would change. Let us hope and work for the same.